Hello, I'm Beth Wagner, Doctor of Physical Therapy. In today's video, I'm going to talk all about wearing a knee brace. I'll start with some general things about braces that are important to keep in mind when choosing to wear a brace for the knee. I'll also talk about when to wear a brace and when not to wear a brace. I'm going to show you 3 examples of knee braces and talk a little bit about how to choose the best knee brace for you and how to take care of the knee brace. All right, so first let's start with what the purpose of a brace is in general. A brace provides external support to a joint or joints in a particular body area. It limits the amount of motion of that joint and it limits muscle activation in that area. This allows the joint and the muscles in that area to begin healing without putting excessive stress or strain on them. It also allows you to continue your daily activities without causing any more damage to that area. So a common reason to wear a brace is for joint instability following a severe sprain or strain in an area. So for the knee, this might include a sprain or a tear of the ACL, MCL, or LCL, or the meniscus. Other reasons for wearing a knee brace include severe tendonitis, a chronic tendinosis, or an overuse injury of the quads or the hamstrings, or possibly even the upper part of the calf muscles that cross over the back of the knee joint. So when to wear a knee brace? The best use of a knee brace is to help with walking or light activity that would otherwise not be possible or that might cause further injury to the knee joint if you didn't have that additional external support. So typically, braces are used to initiate walking or moving around short distances within your home. As the tissues heal, it's important for them to go to work as soon as it's safe for them to be used. Then it's important to wean from using the brace. Extensive use of the brace after those tissues have had a chance to start healing can cause further issues because of disuse or stiffness. So it's important to monitor the use of the brace with your healing time. Moving on to when not to use a brace. The primary example here is when you want to perform an activity that you know your body is not yet ready for. Returning to an activity prematurely before the body has healed can not only cause further injury to the injured body part, but it can also cause issues in other parts of the body that are not yet ready for that activity. Next, I'll talk about a couple parameters in choosing the best brace for you. The first thing to consider is how much support you need for your condition or injury and your use of the brace. Typically, braces range from firm or rigid support all the way down to mild or light support. A rigid or firm support brace is excellent for a severe knee injury where it's important to limit excessive motion of the knee. This will help you get up, move about your world without further damaging your knee. A moderate support brace is appropriate when you've started to regain some strength in the knee and you need some medium amount of additional support. A mild or light support brace is great down the road when your joint has healed almost all the way and you just need a little bit of support to help bridge the gap and help you return to your usual level of activity. Next thing to consider is size. Some braces are adjustable size, others come in a fixed size, typically small, medium, large, etc. So you want to look at the packaging on the brace and be sure that if it is a fixed size, look at the instructions for how to measure your body part to be sure that you're choosing the correct size. And finally, consider the type of fabric. Typically, the more firm, rigid braces are going to have dense, thicker fabric. They're a little less breathable and less flexible, which goes along with the more rigid support. A lighter support brace typically has more breathable, flexible fabric. If you know that you have an allergy to a specific type of fabric, then be sure to choose an appropriate brace for you. Okay, let me show you 3 examples of common knee braces. The first knee brace is a rigid hinged knee brace. This is maximum support and is excellent for a severe sprain or strain where you need to limit the amount of lateral movement, side-to-side movement of the knee. Okay, so the first thing we'll do is loosen up the straps. Now with these braces that have a lot of Velcro straps, you'll notice that when I loosen them or unbuckle them, I'm putting the Velcro back down on the strap. This helps to keep them under control so that the Velcro doesn't attach to each other and all over the place. Now we'll undo the Velcro on the neoprene so that we can see what this brace looks like. Okay, so here's the brace open. Now, sometimes it's obvious on the brace or it's labeled which side is up and which side is down. This brace doesn't have any of those markings on it, which means it's fully adjustable. It can kind of go any way. All right, and now this hole is where the kneecap goes. So I'll put the brace in the front of my leg here, front of my knee, so that the kneecap is right in the center. Sometimes it helps when you first put this on to slide the brace up just a little bit because it tends to sink with gravity and end up being too low. So with it over the kneecap, when I pull down, I should see these metal hinges on the inside and outside of my knee evenly. All right, now to strap the bottom of the brace, I'm going to first start with the lower leg. So we'll wrap the Velcro underneath and take this strap here and wrap it around. And this brace on the bottom is a little bit too large for me, so I have a little bit of overlap here, but it'll work out just fine once I put the strap. You'll see that in a moment. Okay, let's move to the thigh, and we'll pull that snug. I'll take this end, wrap it around, and then pull this one snug but not tight, and attach the Velcro on the other side. Okay, now we can do the additional Velcro straps. Open here, pull across snug but not tight. Same thing here. This wraps around, and I'll just put it right on top of that fabric that's overlapped. Pull it through, snug but not tight. Take this strap, wrap it underneath. And pull that around. And then make a final adjustment. Based on pulling those straps side to side, sometimes the brace can wrap a little bit around to the inside or outside of the leg. Sometimes it ends up a little too low or too high. So double check that your kneecap is in the center of the hole again, and that the hinges are even on the inside and outside of your knee. You can move it a little to the inside and outside if you need to. Pull it up a little bit. Rarely do we need to pull it down, but if you needed to, you could do that. And now I can bend my knee pretty well. You can see once I get to about here, it's limited, but I can bend my knee okay. This brace is excellent at providing lateral stability, meaning my knee is not going to bend in or out. Okay, let's move on to the second brace. Okay, this brace is a moderate support brace, and it's labeled as a sport support. So that indicates that it is meant to offer flexibility while still offering a great deal of support. Okay, we'll unwrap it here, and let's undo the Velcro. Okay, so this is basically one piece of material here. The kneecap goes right in the hole. Now this brace also doesn't appear to have a top or a bottom. Depending on the type of injury that you've had, it might feel better to have this middle strap wrapping around the inside of your knee and the upper and lower straps wrapped around the outer part of your knee, or you can turn this brace around and do it the other way. It really depends on what feels better for your body. Try it both ways and see what feels most supportive. I'm going to demonstrate it this way. I'll center the hole right over my kneecap. And first let's start with the middle strap. So I'll wrap that underneath, and it's going to come up and attach here to the outer part of the brace. Hopefully you can see that okay. All right, now we'll take the lower strap, wrap it underneath, bring it up and across so that it's snug but not tight. And then the upper strap, we'll wrap that underneath, cross it over, and attach. Okay, and once again, let's check. Now you can see the brace is a little bit too far in. My kneecap is over to the side here. So with my legs straight, I can pull the brace, slide it a little bit over. Okay, now when I bend my knee, that looks better, that feels better. Now it's right in the center there. This brace also provides good support. It allows me to bend my knee. This brace, because it does not have the hinges here, would allow for lateral movements of the knee. So it is not as rigid of support. It allows more movement. It also allows a little bit more flexibility, and it's lighter weight than that first brace I showed you. Let's move on to the third one. This is a mild compression support sleeve that is meant to be worn farther into the healing process. Once you're able to bear weight, walk, and do most of your regular activities. This is a helpful support to get you back onto the sport court or out onto the field in a gradual, progressive manner. With these compression sleeves, be sure that you select the correct size. There is always a chart on the back of the package to show you how to measure your knee to be sure that you are in the correct size. You'll see with this sleeve that there is a narrower end and a wider end. The narrower end will go on the lower leg, the wider end will go up on the thigh, of course. Now this brace doesn't have a hole in the middle for the kneecap, but it does have this nice diamond shape to give you an idea of where to center your knee. So we'll pull the sleeve on, center that diamond right over the knee, and adjust so that there aren't any wrinkles or folds in the fabric. Okay, great. Now you can see with this brace, I'm able to bend and fully straighten my knee. So this support sleeve does not limit my motion at all. It allows full free motion, which also means it does not provide as much support. It wouldn't prevent another knee injury from occurring. It feels more like a snug hug right around my knee. This will help decrease any inflammation or any swelling that might occur as a result of that gradual return to your usual activity. I hope you found this information helpful for you to select an appropriate knee brace to help you get back on your feet and doing the things that you love to do every single day. If you like this video, please give it a thumbs up and consider subscribing to my channel. If you have any questions or comments, leave them down below and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.